back when DRGs were actually starting in the 1984, I was actually working in the finance division in the business office of a facility. And I was hearing about all of the changes that were coming about with regards to the coding and the impact that it would have within the United States as they move forward to our DRG system. So I already had a degree in finance, so I went actually back to school to get my HIM degree, and thinking with my finance background, getting some health information management background, I think it would be a perfect fit. My current position as Director of Clinical Consulting, I deliver services to hospitals along with a skill set of with nurses and HIM professionals. We actually review the quality of the documentation to ensure that it is very specific as it impacts the level of coding, particularly as we move forward to ICD-10 with a better granularity of those codes. Also, the impact of documentation to assess it not only from a fiscal perspective, but also from a quality perspective, severity of illness, risk of mortality, to meet all the core quality metrics that are being either privately or publicly reported for the hospitals. Currently, the government has a very big initiative with value-based purchasing. So the government is looking basically to pay hospitals for the quality that they provide. And that puts us, health information management professional, in a key role to ensure that the quality documentation really reflects the severity of care rendered to the patient, as we can describe that with actual health information data, such as with the coding. I've been in this role for almost now 11 years within the role of clinical documentation improvement programs. The level and detail that I do my day-to-day work as a consultant, I travel extensively throughout the United States, the Caribbean, and I've been overseas as well, working with the United Kingdom as well, with their Public Health Trust, doing projects for them for the initiative of quality care, as it is basically not only a national industry standard in the United States, but also a global perspective. I manage a core group of individual consultants as well, virtually, in this virtual environment as well. I do a lot of the public and data mining for reports, for analysis, for statistics, delivering high quality of customer-related services to our customers that we have. Part of my role is to procure new businesses as well. Well, for my current position, certainly a health information management position is very important with regards to making sure that you're able to be an effective individual that can manage a group of individuals, have that management background. It is very interesting that also within my role, I think in the healthcare, as it relates to technology, having some industry standards with regards to understanding softwares and computers, also some knowledge base on financials, data analytics as well. So it's a compendium of many services that from an educational perspective. To have a clinical background as well helps, certainly financials, and for operations management. The advice that I would give to somebody in my role was certainly, first of all, do your due diligence. What you always want to make sure is if you're going to be able to find out what you want to do, you speak to an individual as to what roles are currently available in the health industry, where are we moving with the new technology, new innovations, and do your due diligence. I think you're all very fortunate that you have the internet availability to do all of the networking that you can do and prepare yourself effectively for the changes. We're a day and age where there's a lot of innovation, a lot of changes are happening more rapidly, exacerbated more and more by the changes either at a government level, with technology and informatics. So I think it positions ourselves to make sure that we're able to see beyond what really we've traditionally been involved in before. to think out of the box. Traditionally, most HIM have been involved within the field of the acute care settings. But certainly as we move to a lot of what major topics include, we can also move into the aspects of consulting, clinical documentation improvement, data analysis through technology, data mining with regards to government initiatives for quality initiatives as well. So there's a lot of more than just being within the acute care setting. HIM basically has become a department without walls due to the fact of the internet. So that availability of managing health information, not only in a clinical setting, but also within the quality initiatives of the impact for the consumer as well as for patient-centric care. So I think we need to be thinking out of the box and looking at what health information really entails and be able to provide a little bit of more insight and thinking that I don't necessarily have to work in a setting or a hospital or a physician's offices. Health information management is really beyond, it really doesn't have any boundaries whatsoever.